Hello and welcome to the Healthusiasm podcast, a panel discussion on trends, innovations in health and self-care. My name is Christophe Jauquet. I'm the author of the Healthusiasm books and a professional keynote speaker on health, business and technology. Every week I discuss with a panel of experts the positive changes that are shaping our health and happiness. And for this discussion, we have two of your beloved experts in the panel. From Scotland, but living near Brighton, medical expert in digital innovation, Dr. Keith Grimes.
Good morning, everybody.
From Ghent, Belgium, human experience expert Mo Zoumina.
Hi there.
This means we are missing out on Aline Loiset, who normally should be calling in from Barcelona. She is our digital health connector. But this is a last-minute decision. This is a last-minute recording we decided upon because there was something in the news that we really wanted to discuss with you. Are we ready for this discussion, guys?
Yeah,
absolutely.
Ready to go.
Lovely. So in this episode this week, we will zoom in on how the boundaries are blurring between healthcare, wellness, and consumer businesses, which in other episodes would bring the following question. What behavior, innovation, or trend from one industry can be worthwhile for another industry? But in the news this week, maybe we should reverse that question and ask ourselves, is it really the case that the idea from one industry should be brought into another industry? Because Walmart on Tuesday, the 3rd of April, announced it will close its physical and telehealth services due to a lack of profitability. The operation had grown into 51 centers in the past 5 years and was on tap to hit 75 by the end of this year. In the statement made by Walmart, it said that the challenging reimbursement environment and escalating operating costs create a lack of profitability that make the care business unsustainable for us at this time. Which is a remarkable move, by the way, because in 2019, Walmart stepped into the healthcare in a pretty big way, we can say, because its board of directors approved a plan to open 4,000 clinics by 2029. Now we're 5 years down the road and they only opened 51. So they were far off from the 4,000, let's say. But now the fact that they are completely stepping out of it and even, I believe, selling everything that they have is a big switch. It kind of shows that size alone maybe is not the recipe for success when it comes to health services. But we thought it was interesting enough to bring us all together and have the discussion that we otherwise probably would have on WhatsApp or any other social media, and do it for you here on the episode on the Healthusiasm podcast. Keith, going straight to you. What's your thought when you read it, when you heard the news?
Yeah, I mean, when I heard the news, so I'm a UK-based physician, and this is obviously happening in the US, but it seems to be sort of following a downward trend in what people perceive of a combination of telehealth or virtual services, which was part of their offering, and this sort of dream that people are able to operate something like primary care at scale. For background, I worked at Babylon Health. Babylon, set up services in the UK and also tried to make the move across to America and famously didn't manage that, fell and got crushed against the rocks of moving across to the US. And so we experienced our own challenges in that area, trying to provide digital first primary care to rural settings. So my response to seeing this was like, well, we found it really tough. I'm kind of satisfied that the bigger players also found it really tough. There's potentially different reasons with this as well. But as soon as that sort of faded away, I started to feel very sad because I think Walmart's proposition was, 90% of the US population live within 10 miles of a Walmart store. And therefore, the idea that this sort of underserved population could get ready access was really, really promising. And that promise for now has faded away. And so I'm sad more for the patient care more than anything else right now. Walmart's big enough and ugly enough to take care of itself. But for those patients who maybe make that commitment, that's upsetting.
Yeah, and they were not the only one, right? Because, I mean, what I've heard, and I quickly read through some other news, I think Walgreens, who was also very much focused on trying to provide some primary care services, they pivoted to closing some of their stores as well. Amazon shut down already in 2022 some primary care business. just mainly because they were not getting the buy-in from corporate customers. But still, I mean, the promise of this retail health offering to getting that primary care closer to people, which actually is a big need, because it's hard to have a quick answer to your healthcare questions maybe today. It is sad for patients. That's what I totally believe in. Yeah. Mo, what's your thought? What was your thought when you heard it?
Yeah, I was also a bit discouraged because I was looking forward to someone cracking the code of doing that. But as Keith said, primary care comes with some complexity, some scarcity of people being able to deliver that experience. And I'm also thinking of the backlash we'll have. Imagine a player like Walmart trying to recruit people to work in primary care. I think that has incredibly inflated the cost of talent being active in primary care, and also challenge all those who already are working in primary care and maybe trying to lure them into these centers. I think that has a challenge in the way these people were paid, but also maybe, Walmart has experienced in reimbursed services as long as they're simple. So for instance, they're the market leader in SNAP, which are food stamps, right? 25% of all people using food stamps in the US shop at Walmart. So if the reimbursement model is simple, like pharmacy or anything else, they're very good at it. If the reimbursement model is a bit more complex, like in primary care, it's a challenge. And that might be something interesting. Is I don't think, as we discussed, health in itself might be a challenge, but the complexity of health, when it gets complex, you have difficulty scaling it. So I think they'll stay in health, but in the simple reimbursement things that are quite simple.
Yeah, I'm not quite sure, and I am not, to be 100% sure, to be 100% clear, whether healthcare is not scalable. What I think is that, in a way, I think it's sick care is less prevalent than self care or taking care of your health in general. So what I believe is that from a big corporate point of view who is focused on scale, they might be more interested in the number of people that take care of themselves and who look for basic healthcare solutions, instead of trying to figure out what the healthcare business is about, which very often, and in the future a lot more even, will become very specialized. And so, go ahead.
Yeah, sorry to interrupt. I think
No,
you're
go ahead.
yeah, you're right on this. I was just reflecting, particularly as Mo was speaking. Just there's this situation where if you're dealing with things transactionally, if you're dealing with things almost on a fee for service basis. And I know they weren't quite doing this, but they were working on membership. In the UK, the model that operates for general practice is one of capitation. Regardless of whether you see a person 100 times or one time or not at all, you'll receive a certain amount of money to provide all the care. And in that situation, there's a great reward in focusing on excellent primary care, on prevention, on reducing reattendance, because if you can get a person well enough to not come back for a period of time, then you're not having to pay to have them seen and so on. When Babylon was offering GP at hand, part of the problem was that Babylon would spend quite a lot of money on providing 24/7 access to care, but the savings were delivered downstream outside the sort of boundaries of Babylon. A paper that they released, which was published a couple of years ago, within that showed that the acute hospital spend in areas where Babylon operated went down anywhere between 12 and 50%. But there was no way in which they could recoup this as well. And I wonder whether that maybe has part to play in what's going on here. It's very, very difficult for your Walmarts or Walgreens, if they do brilliant care, but it stops people going into hospital, or it takes 5 or 10 years to sort of manifest that, that's well outside the window of the way they've set up just now. I think otherwise, the marriage of, we know how important diet and life and social determinants are to a person's health. It should be a marriage made in heaven, having the principal place where people access this healthcare. The idea that a person could have healthy food and then, tie it all together works well. So I'm hopeful that it could be brought together. But I think in this particular model and what they were expecting surely didn't pay out. Maybe that was why they took this option.
Yeah, I think if you look at on the healthcare spectrum, what do we have? We have self-care, no, anything before people get sick. we have primary care. I'll just simplify it in a certain way that I
Yeah.
see it, right? So you have self-care, you have primary care, which is the first point of contact for some basic, healthcare relief maybe, or health problem relief. And then you have specialized care. I think on the one hand side, the specialized care will become in the next 5 to 10 years very, very specialized. And I think any healthcare center, hospitals will become huge centers of expertise with knowledge that it will be very hard to comprehend. It will never become something that maybe even retail stores or those kind of companies could manage. So I really see this healthcare at the end becoming very specialized. On the other side of the spectrum, we have self-care, which is becoming super popular, which is becoming very accessible, which has different stakeholders and different views on health even, and that is growing massively. And in between, you have primary care, which I believe is at this moment a bit no man's land. It's the entry into the specialized care, but it's getting closer to the self-care as well. And I think what Walmart tried to do is, and many others of those stakeholders, they try to have that, take that middle field. But that middle field is, as I said, to me, it feels a bit like, where is this going? Will it become more specialized and move more into the healthcare sector, or will it become more self-care? And I think because of the reimbursement, the primary care setting is part of the healthcare system, and the reimbursement there and all the costs there and the way that is operated is very slow, is very heavy. And if that doesn't change, I believe that this primary care setting still will remain no man's land until something changes there. So I really believe that the only way that primary care will change, it will not be by physical players or retail players, because they will focus more on the big markets, which is self-care. But I think it has to do with automation. It has to do with digital health solutions, and the whole, I always say, physicians, pharmacists, insurance companies, sick funds, what have you all, they are the ones that will be most disrupted in the next 5 to 10 years, probably, because they are in between those two magnetic fields that are changing rapidly.
Mm. Interesting take.
When I heard you talk, Christophe, I kind of also heard a second narrative, and hear me out. What if primary care got obsolete by the rise of diagnostics that are very low threshold, meaning that you will get diagnosed on something specific and specialized sooner, whether it is cancer, whether it is something else, right? So that primary care might be a kind of self-service thing, right? Where for the flus and anything else, and where the diagnostic acceleration will get you into specialized care faster, but earlier too, right?
Exactly.
So what I kind of hear you saying is that maybe primary care might implode, and that you have self-care and then very specialized care, and then we have, as you said, no man's land, but also a vacuum, right?
Yeah.
Because the vacuum in itself is high maintenance with people and everything else. And maybe that might be a visionary move from Walmart, saying, we're getting out there.
That's what I think.
Yeah, but
Yeah.
we'll
So
have
this is
diagnostics, and then, yeah, Keith.
sorry to cut across. I'm smiling because I disagree with you, and this is always good stuff. Is I see potentially the complete opposite. Now, conflict of interest here. I am a primary care physician and a GP, so people talking about the death of that particular sector, I'll obviously kind of bristle a little bit. But if you hear me out a little bit, I see specialist care as the completely replaceable and transactional part of it in some regards, particularly if it becomes super specialized, because if I have a specialist in one area, conceivably I could get that from any place, or an AI. If it's just specialist knowledge, I could just get it anywhere. The thing that I think is very valuable that's missing out in this is the complexity of the fact that people do not have just one thing. Even if it's something as simple as a broken leg, there's a biological, psychological, and social aspect of it. So it can be treated in one way, but it impacts on everything else. And that's just something as simple as a broken leg. You have a person with chronic diseases in their life and wellness and everything else, and their mental health in there. Primary care operating well as this continuous holistic look across the entirety of a person's health and how you can optimize that as well. In my experience, I've seen that handled less well in specialist settings than in primary care settings, or at least good primary care
Yeah,
settings.
totally true.
That kind of comprehensive side of things. So I put that. And then the second thing is, where does population health sit as well? Specialist, the specialist areas might be interested in the population health impact of a particular narrow area, potentially, but who looks across the population requirements, the public health requirements of that? Is that primary care, or is that a separate public health function? So yeah, delightfully for the conversation, I disagree, but maybe throw that into there as well. That Walmart failed in this one right now, maybe they should have bought a hospital instead.
I think you're right, and you're not. Let me just explain. I think this is going to be a memorable one. I think the fact that people require to be cared for in that matter, in a holistic matter, I totally agree. The question is, will we be able to do so? And will we find it important enough to do so? I'm not sure. Right. So yes, it absolutely makes sense from an economical point of view and things like that. And then the last thing I also see is that I don't know if you looked at it, the rise of vaccines being developed for conditions that are preventable is incredible. I think the blind spot is vaccines, and also, think about exosomes. There are technologies being developed in vaccines that will kind of cover the basics, right? Which is not, I think, a very good evolution if you think of population health and things like that. But if you look at the pipeline of vaccines, they're trying to develop vaccines for a multitude of conditions, right? So once again, I totally agree that holistic health is something that absolutely makes sense from a societal point of view, from an ethical point of view, even from a financial point of view. But I'm not sure we'll be able to cater to that, Christophe.
Yeah, and I think to piggyback on that, I do fully agree with you, Keith, that this holistic view on one's health will be even more important and valuable in the future. I'm just not sure whether the current primary care stakeholders will be able to do so. And I'm wondering whether that part will become or move into more of a self-care setting, which is less part of the healthcare system, or whether it will be handled by some sort of digital solution. A bit, it made me think of the vision of Forward in the States. You might have seen a couple of months ago, we even talked about it on the show here, these pods where people can go into, and then you do some basic testing, diagnostic testing, and get a complete, they say holistic, but it's not holistic view yet on your current health status. And behind the scenes, there's some physicians, but you don't really get into contact with a physician unless it is necessary, and that is the access into healthcare, maybe even specialized care for sure. And so what I'm saying is that we still need primary care. I think if we're talking about disruption between those two, as I call magnetic fields, I think the biggest disruption is there. And what Walmart did here is they realized that they will not be part of that primary care setting, and that they will move into more in my opinion, the self-care setting. And that, again, this primary care setting is open for the grabs. Is that how we say it?
Yeah, it's up for grabs kind of thing. Yeah,
still, it's up for grabs. So I mean, and I'm curious to see who will radically change that primary care setting. And a company like Babylon might have been maybe one part of that solution, maybe, but there's plenty other digital health solutions that will have an impact on how primary care will be managed.
Maybe, no, I can agree on that. And I think the problem is that it is not simple. Like, it's very, very tempting to think, oh, medicine is simple because, and then you insert a simple solution here as well. It is complicated. So actually, I agree with you. I think the current setup of primary care isn't fit for long-term purpose. Right? It has to change, and how it changes, we will see. So I also think it is interesting when you look at Walmart, is they're divesting themselves of the primary care side of things, the in-person clinics and the virtual side of things. But within that release, they're investing heavily in their pharmacy and opticians. And what's interesting is they're expanding the range of services in the pharmacy side of things to include typically clinical practices, screening, transactional care, and so on. So they're not getting out completely. They're just getting out of the messy bit. and they're keeping the simple bits. And
But that's
what
what
does that then leave?
that's what I refer
Yeah.
to when I say that's what I refer to when I say that they are moving more into the self-care part of things, because they are taking things away from the primary care and they make it a little bit more self-care-ish. And that, I think, is the change that we're seeing.
Yeah.
It's also
Yeah,
interesting.
fair point.
I'm coming back to the vaccines. Is the relative perception of health is, let's treat you before you get it. And there's also recurrency on the vaccine, right? Few vaccines are for life, right? So there's a recurrent model on the vaccines, and also the perception of you might get it, so let's treat you now, right? Is also an interesting point where you can't really say that you've saved lives, right? You can't say you're still living because we vaccinated you, right? So there's kind of a thing there's some diseases coming up, even a vaccine for diabetes and things like that. And the probability that you get it is very high thanks to society today. So let's just get it out of the way and make that into a recurrent model.
Yeah.
And maybe there Walmart might play a role where the vaccines are delivered, because the diagnostic part on the vaccine might be interesting in just injecting the vaccine, as we see pharmacies doing today, in Belgium.
Yeah, that's part of their offering
goes,
is vaccines.
Yeah, but it goes beyond. I mean, one of the quotes I often say is that good health is more than not being sick, right? And so vaccines is one part of that not being sick, which could be treated in many or which could be managed in many different ways. But I think that this dynamic about wanting to be in good health, this is what Walmart wants to play in primarily, because that is where most people are. That is where their scale makes sense. Health is everywhere. Diseases are not. However you look at it, health really is everywhere. And that's why I think that they.
But who benefits from health? What is the valuable business model on health?
It's that people want it.
I know.
People want to be. It's the deepest. I mean, you've pre-read my book, so you should know what I would say here. But the thing is that everybody wants to be healthy, and everybody wants to be healthy and happy, right? So
yes. The only problem is, if being sick is cheaper than being healthy, we have an issue. And for instance, it might not be the case in the US, but here in Belgium, right, we see it. And I think we have a cultural change, paying out of pocket. We see the out of pocket cost for health being
increasing
through the roof, right? The contribution you have to do. We see it firsthand in Relief Clinic, where we are struggling with the fact that we're not seeing our patients again, because they have been sustainably helped. The pain is away and things like that, but we have to feed our funnel. So we are in that transition also with Relief Clinic, that the fact that we're doing a great job, right, in not having people come back to us because they have sustainable health and well-being, does not have a recurrent business model, as Keith said, right? You are not being rewarded for the fact that you've helped people in a better way. And maybe that is a cultural change where people are willing to pay a recurrent fee for staying okay, for being okay. But for the moment, I'm talking about Europe, we're not there yet. But we'll get there.
Great. Maybe I think it's time to wrap up. If there's maybe like one statement or takeaway that you would, because it's a big thing, right? Walmart, one of the biggest companies in the world, that says, I'll stop with health care, primary care. It's a big thing. If there's one takeaway, one thought you want to leave the audience with, the listeners with, what would it be? I'm just putting you on the spot here, Keith. What would it be, perhaps?
I'm trying to sort of formulate it into a simple answer.
Maybe you should start.
Yeah, it gives me more time to think. Christophe, you first, and then I'll say.
Yeah, I have a couple of things, I think, but the one thing I really want to convey, and I know that quite some listeners that listen to the Healthusiasm podcast are working in healthcare. They are interested in anything that's related to innovation, otherwise you wouldn't be listening. But the one thing that I want to put out there, and I put it immediately on LinkedIn as well, is that it's not because Walmart is moving away from this primary care setting and everything that they're doing. It does not mean that you need to yell, you see, it's yet another non-healthcare company that wants to make a big buck by moving into healthcare, but it's not that easy, so they better stay out of it. I kind of don't like that sound of it for two reasons. One is we shouldn't brag about too much that healthcare is so complex. It's a sad thing because Walmart could have changed a lot of of the experience that is related to health. So I really regret this. But also, I think you should not underestimate the fact that Walmart is a private company who's looking for profits. And so if they take these decisions, it is based on changing how the world is changing and where they think they should be playing and where they can make an impact. So it's not because they're stepping out of it that it is a fail. It is because they realize that they can make a bigger impact in health somewhere else, because they're not leaving health. They still have 5,000 pharmacies and 3,000 vision centers and what have you all. So they will play a role, probably more in the self-care area, but they will play a role in healthcare. So let's not just quickly jump to the conclusion like, oh, non-healthcare stakeholders, please stay out of the healthcare business, because I think they can bring a lot. The fact that it's not working is sad, and it's just a strategic shift, which makes, to me, totally sense at this point. Yeah. That would be my takeaway.
Yeah. And you've given me enough time to formulate. I'll go first. You gave me, oh no, Mo, okay. Sorry, Mo. I want more time to think.
No, I think in the interaction between the healthcare provider and the individual, I'm going to quote a specialist in behavioral science, which is BJ Fogg, who has a formula. He says behavior is motivation times ability times trigger. We tend to overestimate motivation. So I think one takeaway from this is, if you can keep it, I think one takeaway from Walmart here is that the complexity. I think they're trying to reformulate health in a way that is more simple, more accessible, more scalable. And in that formula, the A stands for ability, and the ability is about convenience and simplicity. If you want people to do things, right, keep it simple, but also simple for the organization. And if you keep it simple, it's also easy to scale. So I think, as you said, Walmart is not getting out of healthcare. I think it's moving into more convenient, simple healthcare, because it's part of the DNA of Walmart, convenience, right? So I think that might be the reformulation of how it can have a larger impact, and finding the formula to make it easy and accessible so that it can scale.
Sounds great. Yeah. Sounds great. So, Keith, you had plenty of time. I don't know, you probably listened to us as well in the meantime. But now the pressure's really on, my man. Come on. Give us something.
Right, here we go.
It's a last sentence. It's the last part of the pod.
Prepare yourselves. Here we go. No, the first thing is, Christophe, I am, like you, irritated by the people saying, I told you so. Like, look at this. I told you it was complicated and blah, blah, blah. It is complicated, but the incumbents are still not doing a great job. The fact that someone has tried something different and has at this time not proceeded with it, or not succeeded with something that you recognize as primary care, is no reason to boast, so we need to be very careful about that. That's the first thing. But the more important thing is that healthcare is two words. It's health, which we've talked about, and I think that can be broken down into transactional parts. And then there's care. And care, I think, is uniquely beyond one person's ability. You can care for yourself a little bit, but actually a lot of it comes from interacting with another person, either a person close to you or a care professional as well. And I think what's happened here is that they've realized that for a person to feel like they're getting complete health care, you get the health served, but you have the care served. And that care service comes from contact with people, either face-to-face, virtually, and a continuous experience. The use of technology to automate and make things easier and take away the transactional stuff should really leave space for us to care. And it's used an awful lot. What is the model for the provision of care is the bit that we need to see the innovation in as well. That has a longer horizon, and I think that played into what was happening here as well. But yeah, my point on this is that we need to focus and preserve that part where it's important to allow people to really get what they need.
Lovely. Yeah, you did well, Keith. I mean, you took the time, but it was really well done. Good closing of this discussion. Thank you both for this discussion. Right now, it's time to wrap up the Healthusiasm podcast for this week. Thank you for listening. If you like the show, don't forget to hit the subscribe button on your favorite podcast platform. You can also visit healthusiasm.com to discover the other episodes, subscribe to the newsletter, and learn more about our panelists. For now, I'd like to thank our panelists for their healthusiasm. Thank you, Dr. Keith Grimes and Mo Zouina. My name is Christophe Jauquet. We are the Healthusiasm panel, and would love to see you again next week for some more Healthusiasm. Ciao.